back today and for tuning in. And I do know that these days.
And good afternoon to you folks. It's just after 2:30, and that means Governor John Bel Edwards is delivering his daily update on Louisiana's fight against COVID-19. Let's listen in.
And just because the social distancing and hygiene guidance and the stay-at-home order remains in place day after day doesn't mean we shouldn't talk about those things, because that really is going to be the key to success in trying to get through this public health emergency with the fewest amount of cases and certainly the lowest death total. I want to thank Dr. Corey Hebert for being with us today. He's been a practicing physician in New Orleans for decades, although he doesn't look that old. I'm told it's decades. He's the chief medical officer for Dillard University. He's a professor at LSU and Tulane, and he is also working with the State Office of Public Health. And it's great to have you here today. He will take some questions. He will have some prepared comments and take questions after I'm finished. We obviously have Dr. Alex Bu as well from the Department of Health to take questions related to testing and other things. You know, Dr. Hebert is here today because we mentioned a couple of days ago for the first time some disturbing statistics coming out of our analysis of the information we're getting, and that is that while about 33% of the state's population is African American, over 70% of the deaths in Louisiana because of COVID-19 are among African Americans. That is very concerning to me and to others, and it's unacceptable. We want to better understand why that is, what we can attribute it to, and then how we get rid of those disparities over time. But are there any interventions we can make in the short term that will lessen this? And of course, all the guidance on social distancing, on staying at home, and hygiene, they apply to everyone. And that is in the short term what everybody should be trying to do to minimize the chance that they will contract this disease. Today we are reporting 746 new cases. And you can see that the total number of cases is now just over 17,000. It's 17,030. That's a little lower number than we've been seeing for our daily case growth. But I want to, again, remind everyone that we cannot let our guard down, because if we are seeing fewer cases, it is because of the efforts that we are making in order to minimize contact with other people. And so we have to continue to be focused and continue to be patient. Unfortunately, like yesterday, we were again reporting 70 deaths. One is too many, but this number is still much higher than we want it to be, obviously. That matches yesterday and matches the highest number of deaths that we've reported in a daily reporting period. Again, not all 70 of those individuals expired yesterday or within the last 24 hours, but that report came in today. We have 1,983 hospitalized patients who are COVID positive. That's actually a little bit down from yesterday, which was 1,996. But if you look at COVID positive and persons under investigation who are together hospitalized, if you look at both of those numbers are up by 238. And at this point, the vast majority of individuals who are under investigation, meaning they've got the symptoms, they need hospitalization, they've had a test, we're waiting on the result to come back, those individuals, the vast majority of them at least, will be COVID positive. So overall, the hospitalization number is up. But the rate of growth in hospitalizations is in line with us being on a lower trajectory for case growth than where we were last week. There's also some good news with respect to ventilator utilization. Today, that number is 490, where it was 519 yesterday on COVID positive patients. And it's also down if you look at the entirety of the hospitalizations for COVID positive and persons under investigation. So that is a good trend, and it is due in large part to some medical practices that are, in some cases, being pioneered here in Louisiana to keep people off ventilators in the first instance and to wean them off earlier than otherwise would have been the case before. And there's some things that are being developed here, lessons learned here, that really do constitute best practices that other parts of the country are starting to pay attention to. And Dr. B, you can talk more about that later if you're interested. And so where we are on the modeling, because I know we've had questions about that every single day, the simple fact of the matter is that the number of new hospitalizations suggests that we're trending in the right direction. But thus far, the number of deaths is higher than we want it to be to have corroboration of that. And so the two most essential data points are not in agreement. Overall, we think we probably are heading in a better direction with a lower trajectory, and that we're starting to flatten the curve, but we can't be sure yet. But what we do know is if people misunderstand what I'm saying and they start to thinking, oh, we've got this thing where we want it now and we're moving in the right direction, therefore we can let our guard down and I can start having my dinner parties and I can start doing what I want to do, we're going to see those cases spike right back up. And so I'm encouraging everybody, imploring everybody to make sure that you continue to comply with the stay-at-home order, that you continue to engage in social distancing when you're out. If you're going to be out and in close proximity to other people, it is now a CDC recommendation that you wear a face covering, not necessarily a surgical grade mask or an N95 mask, which those things continue to be in short supply for our healthcare providers. So I'm specifically asking that you not do that, but that you find some face covering that you can use. There are anecdotal reports and that we have more people out and about on the streets today around South Louisiana at least than was the case yesterday. And I hope that's not true, first of all. And I hope that nobody received the information we put out yesterday as any sort of an indication that we can relax and let our guard down, because that is exactly wrong. And in fact, our messaging here in Louisiana and the messaging coming out of Washington, D.C., whether it's the President, the Vice President, Dr. Fauci, it is entirely consistent. And his end date for the 30 days to stop the spread and my end date on the current executive order, both are April the 30th. And as we get closer to that date, we will reevaluate the situation and see what things will look like after April 30th. But we need everybody to be very patient. We just recently learned that Louisiana health centers are going to get nearly $27 million. There are 36 such health centers across the state of Louisiana. These are federally qualified health centers. They're going to get $27 million through the CARES Act. That was our allocation, and that is very helpful because it's going to help us to detect the virus and prevent, diagnose, and treat the disease, COVID-19. Region 1, which is the New Orleans, Jefferson Parish area, continues to be the biggest hotspot in our state. We are closely watching Region 2, which is the Baton Rouge area, Region 3, which is South Central Louisiana, and Region 7, which is the Shreveport area. That is not to say that we aren't watching every single region of our state, but we're analyzing the data every single day, and those are the areas that we're paying the most attention to with respect to case developments and hospitalizations and deaths. As a proactive measure, we're sending 45 ventilators today that came from the Strategic National Stockpile. So the last 200 that were approved on Friday that were received over the weekend, we're sending those to the Shreveport area. And we are continuously in the process of communicating with hospitals to ascertain what their needs are and then to allocate resources accordingly. We are watching the entire state, as I mentioned a while ago, and we want to make sure that everybody is trending in the right direction. And it goes without saying, I think, that some areas of the state are behind others because we know that this virus seeded pretty heavily throughout the New Orleans, Jefferson Parish area earlier than it got to other states. And so trends that are true in one part of the state may not be true in another. And so we have to watch all of this very carefully. I'm also pleased to say that today in Shreveport we're standing up a testing center at a Walmart facility. This will be the first of its kind in our state. It will test first responders, healthcare workers, and people who are over 65 and that are symptomatic. It will be a relatively soft opening today to make sure that the process is correct, and then it will resume tomorrow. And we're also on track to have a similar testing set up in St. John the Baptist Parish in Laplace at a Walmart on Saturday. Again, with a soft opening on Saturday for the same categories of individuals. They will then close for Easter Sunday and then reopen again on Monday. One other note about the New Orleans area, and I do this to try to make sure that we're completely transparent and that rumors don't get a foothold. The Carnival Valor ship, this cruise ship, the home port is in New Orleans. It is coming into port without passengers but with crew. 300 crew members who have tested negative for COVID-19 and who do not have any symptoms will get off the ship. Will board buses that are chartered to take them to the old airport terminal in New Orleans, where they will board chartered flights and go back to the countries where they live. Other crew members who have tested positive will stay on the cruise ship. They will not get off, and right now none of those individuals require hospitalization. However, if any of them do require hospitalization, we will take those individuals into our hospitals in New Orleans. There have been a lot of organizations that are working to help get these crew members back home safely, in addition to Carnival, and they include the CDC, the Louisiana Department of Health, the City of New Orleans, the Coast Guard, and the river pilots and the Port of New Orleans. And I want to thank all of them for working so hard to make this happen. We do have a little bit of good news when it comes to unemployment benefits. Last night, we received the funding that was contained for Louisiana in the CARES Act, so it will enable us to start paying unemployment benefits in the amount of $600 per week, in addition to the standard weekly amount that you get through the state benefits. And that will go through July 31st. I have instructed Secretary Ava Dashwa, the Louisiana Workforce Commission, to begin making those payments on Monday. That's Monday, April the 13th. And this includes, and this is really important, this includes the 1099, the salon, the gig, and other self-employed workers who had a benefit coming through the pandemic unemployment assistance, but that funding wasn't received until yesterday. We will begin making those payments on Monday. So we continue to urge people to file their initial claims and to continue to do their weekly recertifications. Both of those things are important so that you can qualify for and continue to receive unemployment benefits. And while it may be somewhat inconvenient, although we're asking you to stay home, so hopefully you can make this work, the best hours to file are between 10 p.m. and 4 a.m. just because of the volume, and to do it online. The website is louisianaworks.net, louisianaworks.net, and I encourage people to file their claims, do their weekly recertifications, do it online, and try to do it during non-peak times, and you won't have as much trouble getting through, and it won't take you as long. I do want to give you an idea of the volume of claims that the Louisiana Workforce Commission has handled over the last 4 weeks. Between March the 1st and April the 4th of this year, there have been 277,000 Louisianans who have filed with the Workforce Commission for unemployment benefits. In contrast, in all of 2019, the number of claims was 103,000. This week, from April the 5th through the 8th, Louisiana Workforce Commission paid $25.5 million in unemployment insurance benefits from our trust fund. In the two previous weeks, they had paid $21.2 million and $4.8 million for a 3-week total of just over $51.5 million. In a typical week before COVID-19 came to Louisiana, weekly benefits in the aggregate totaled about $2.3 million. With Office of Motor Vehicles offices closed around the state of Louisiana, I do want to remind you that the LA Wallet app is free. So I'm encouraging people to go and download that app. Additionally, some people will be eligible to renew their driver's licenses through the apps, even while the offices are closed. And there is usually an $18 convenience fee associated with renewing your license through the app. That will be waived during the pendency of this emergency. Now, you can only renew your driver's license through the app if this is not your time to go in and have your eyes checked. So if the last time you renewed your license, you went in and you had your eyes checked and you did those things, and you can renew your license this time on this app, again, without having to pay the $18 convenience fee. So I would encourage people to use LA Wallet for that purpose. I also want to share an important announcement from Bristol Myers Squibb. They're going to help unemployed patients in the United States who've lost their health insurance because of the COVID-19 pandemic. They've expanded their patient support program to offer access to any Bristol Myers Squibb medicine for free to those who need it. The program will be in effect for 6 months. Once the program ends, patients already enrolled can continue on the program until such time as they secure insurance. All Bristol Myers Squibb patient support programs, as well as additional eligibility requirements, can be determined if you call 800-721-8909. That's 800-721-8909, or by visiting bms.com. bms.com. Finally, before I take questions from you all, actually I'm going to yield the podium to Dr. Hebert, and then we'll come back for questions. I'm going to take a couple questions that have been submitted from members of the public. We started this yesterday. Questions can be emailed to askjbe@la.gov. askjbe@la.gov. I think we received about 700 questions. We're going to take 2 of them. Lisa from Tickfall asks, I am from Louisiana but traveled to Texas to visit family. Will I be able to travel back to Louisiana? The answer is yes, you will. There have not been restrictions on travel to and from Texas. Here is what's happening for vehicles that are not from Texas. And by the way, these are not just Louisiana vehicles. This is any vehicles entering Texas, regardless of the state they come from. On those major routes, Texas DPS troopers have set up screening points at the state lines where they're stopping vehicles at certain intervals. They flag about 6 to 10 cars that they then direct into a screening area at the Welcome Center. And then while they screen those cars, the traffic flows uninterrupted into the state. So they're stopping 6 to 10 cars at a time. The rest of the traffic continues to go. For the traffic that they stop, they inquire about where the motorists are traveling to, and they ask them to quarantine for the first 14 days if they're going to be staying in Texas. They may be asked to fill out a form about their destination. It continues to be the case that no commercial vehicles are being stopped. The state police here in Louisiana have not seen any significant delays or backups because of this, but additional troopers have been deployed around the state line should they have problems such as breakdowns and traffic delays and that sort of thing. Jennifer from Labadeville asks, when do you anticipate, if everyone follows the stay-at-home order, we will be able to go back to our daily lives as we knew them before? First of all, I appreciate all the questions, and the premise of this question is, if everyone follows the stay-at-home order. That is very, very important, because I promise you, no matter what the timeline looks like, it's going to be quicker if everybody follows the stay-at-home order. What we know is that the virus is going to dictate the timeline, not us. We're not going to be able to pick a date on the calendar. I think Dr. Fauci said it yesterday or the day before. This is not like flipping a light switch where the lights are either on or off. We do believe we're beginning to see the flattening of the curve, but we then have to come down on the other side, and we know that cases can spike. For example, somewhere around 95% of the state of Louisiana will not have been infected if this virus goes away quickly. That means they can be infected later on. And so until such time as there's an effective, clinically proven therapeutic intervention, some drug that can treat this disease, and a vaccine, I don't know that you're going to see life as we knew it before COVID-19. But there's going to be some transition period. Exactly what that's going to look like, when it's going to start, how long it's going to last, I cannot tell you today. We're going to be leaning heavily on the federal government, the CDC, people like Dr. Fauci and others, and with our Department of Health. It is going to involve an awful lot of testing to determine who has it, contact tracing of those individuals, and a lot of isolation. But we will be easing back towards life as we lived it before COVID-19. But that's going to be some period of time in transition. And I think everything that I'm saying today is fully consistent with what you hear out of the federal government at this time as well. Although I do look forward to the day when we can start to reopen the economy. I don't know when that's going to be, and when people can start to move about more freely and so forth. But I do appreciate the questions. So at this time, I'm going to ask Dr. Corey Hebert to come up and deliver some prepared remarks. I would ask that if you have questions for him about the subject matter he's going to discuss with you, that you ask him while he's at the podium. And then when you're finished with that, if he wants, he can stay or he can depart. And then Dr. Bu and I will stay and answer your questions as always. Dr. Hebert.
Thank you. Just want to tell everyone to take a big breath, and we're going to be okay. Governor Edwards, I want to thank you for your leadership, because without it, we would be in a much more dire circumstance. I'm just happy to be home. I am from Baton Rouge, although I reside in New Orleans. I grew up in an area that most of you may know called the Greater Eden Park area. And growing up in that area, I witnessed firsthand how the lack of medical care can directly cause an entire community to have unrelenting global issues. Thomas Paine, in the work The American Crisis, wrote, "These are the times that try men's souls." Well, ladies and gentlemen, I will tell you, at this time we are definitely in a crisis, and the soul of the state of Louisiana rather, is being tried. The coronavirus is ravaging our state in the form of a disease called COVID-19, and specifically the numbers of African Americans who have succumbed to this disease is clearly disproportionate to the absolute number of black people who reside in this state. The explanations for this are multifactorial, and I will try to elucidate some of these issues today, as well as give solutions, and finally try to give some hope and inspiration to my people's fight against the scourge of this pandemic. We know that this is a really difficult issue. We know that African Americans are very smart people and descendants of kings and queens, and we are not any way weak or shiftless or slothful in the quest for wellness. Every citizen needs inspiration to find the fortitude to reach a collective goal. The challenge is, if on your road for excellence there is a roadblock, and then another roadblock, and then another roadblock, and after some time you see another one, you get a little weary. But as we sit at this crucial juncture, surrounded by this carnage, as African Americans, we cannot and must not be weary. This is a defining moment for this generation of African Americans and Americans as a whole, because we must rise to defeat this monster. Our goal is to energize and to focus our African American brothers and sisters on the true goals presently in our view, the goals of survival, the goal of thriving, and the goal of ultimately having full responsibility for your own well-being, and not based upon the roadblocks, but based upon your ability to hurdle those aforementioned roadblocks, which were sometimes inadvertently and sometimes strategically put in your way. I'm not going to preach. That's not what this podium is for. However, I need you to understand it's our job as a total society, not a black society, to protect the vulnerable, and African Americans are the most vulnerable by being disenfranchised and systematically marginalized for generations. We know that the HIV/AIDS epidemic, and now through coronavirus, this pandemic, these disparities have obviously reared their head yet again. We in the medical community have been well aware that this was a looming threat for a very long time, and we watched this as it spread throughout China and arrived at our borders. As I quote Dr. Anthony Fauci yesterday, this disease will shine a very bright light on a weakness of our society. As we negotiate this pandemic, our path invariably begs the question, why are blacks being affected in this way? We are your service industry. We're the people driving your trucks to deliver goods, and all that's true. But there's overwhelming data which points us squarely to the social determinants of health, as defined by the Centers for Disease Control and Prevention as conditions in the places where people live, where people learn, and where people work and play. For public health professionals, these are the cornerstones that we use to evaluate and in turn bolster our care in the midst of all distractions and turmoil. And it stands to reason that African Americans have historically been overlooked on the path to wellness that these categories lend to. When we think about trying to tip the scales so that African Americans can have equitable care, it's a tough road. It's a very tough road. But what we have to remember is that we will tip the scales in the favor of the black population, but make no mistake, this is in no way any bootstrap movement that I want you to pull yourselves up by. If we are to get it to a better place, we need statewide support, which I've been assured we will have through our great governor. I am actively working with Dr. Alex Bu with the Louisiana Department of Health and the Office of Public Health to roll out a phased approach to address the alarming death rates in proportion to the reported cases. The trend of desperate black and minority deaths under Governor Edwards' leadership, as soon as the data revealed this disparity, he has worked tirelessly and immediately commissioned and supported key statewide officials to work with Dr. Bu to educate various distressed communities and employ additional strategies. And this is what I want people to understand. I could surround you right now with so much data from erudite scholars, and I do want to give you one particular case. There was a study that was put out about 17 years ago. It was the publication of the Institute of Medicine's Unequal Treatment Report, which synthesized a wide body of research demonstrating that U.S. and racial and ethnic minorities are less likely to receive preventive medical treatments than whites, and often receive lower quality care. And most startling is the analysis found that even after taking into income, neighborhoods, comorbid illnesses, and health insurance, these factors typically invoke to explain racial disparities. Health outcomes among blacks in particular were still worse than whites. We're still living in a time where there are vast differences, and these differences directly relate to what's going on in Louisiana right now and the seriousness of COVID-19. One thing I want to step back and say is that our governor took the heroic step and expanded Medicaid. When I explained to you that we would be in so much more of a dire circumstance had we not expanded Medicaid, which has allowed hundreds of thousands of people to be able to get primary care. Black people, white people, everyone has been able to achieve at some point the ability to get quality primary care, and that is cause for no concern. And now we must address systematically and modify emergently how we live, work, and play, so that these social determinants of health will be demolished when it comes to the seriousness of the African American issues in our great state. What will happen now? This is what I've been asked. What will happen now? Well, we know that the curve will probably flatten. We want you to hunker down and double down and do what you need to do. This office and all the medical professionals will make that happen. But it may rear its ugly head again. And if it does, we need to be ready. African Americans, listen. We need to be ready. We need to eat better. We need to decrease our salt. We need to decrease our sugar intake. We need to quit smoking. We need to exercise 30 minutes a day. Decrease our stress. The reason why you must decrease your stress is because when you have a stress syndrome, your cortisol level goes up, your epinephrine goes up, which makes your immune system go down. So the more you stress, the more you panic, the more apt you are to get this horrible disease. We want you to understand that when you panic, what you do is you think that there's no constructive, serious thought going on to make sure that this disease goes away. But I must tell you that through our agencies, there is a lot of quality education and quality thought going on behind the scenes for us to be able to get rid of this horrible illness. we will win. I guarantee it, we will win. With this man and this man behind us, we will win. And I want to thank all of you, because without you, we will not be able to win, and you will all help us. I want to leave with a quote from an African American, as I started with a quote from Thomas Paine. And the quote is from a scholar, Benjamin Elijah Mays. I want you to think of this as a job. Challenge I've given you, it's a job. And Benjamin Elijah Mays said, I want you to do your job so that no one living, no one dead, and no one yet to be born could ever do it better. I don't want you to have any pressure because of that, but I want you to do what we say and know that we are going to support you with the messaging and the outreach that you need through the agencies of this great state. Thank you very much, and I'll take some questions. Yes, ma'am.
In terms of, I mean, obviously the things that need to be addressed here, a lot of those are long-term factors that can't be, you can't turn a switch and fix them quickly.
Exactly.
So are there any short-term things that can be done to help minority communities to combat coronavirus at this point?
Yes, and I think that's the most important question, because the studies all show that when people want to hear things from you so that you can actually have an action item so that they can actually do it, it needs to be done in a way that they understand, they can relate to. So we can have Dr. Anthony Fauci come here and speak to African Americans all day long, but sometimes that message will not resonate because Dr. Anthony Fauci doesn't actually know the African Americans in the Louisiana community. And that's what we're doing with the state agencies, to be able to provide that messaging, because things are a lot different now. People know what they need to do for all practical purposes. They need to be inspired to move and do them. And my job, and this agency's job, and our state's job, is to inspire the people to do the things that we need to do. The things sometimes are simple and sometimes they're complex. However, no matter their complexity, these must be done for us to flatten the curve, for us to make sure that our most vulnerable populations, and I don't mean just black people, and I say that because anybody that's been disenfranchised, that doesn't have quality health care, that doesn't have a primary care doctor in a rural community, is also going to be affected by this disproportionately. It's just that those numbers tend to be a lot of black people in the state of Louisiana. But let's be very clear. Yes, ma'am.
And for those people who are most susceptible to catching this disease, is there any data that shows that you can catch it twice?
Okay, so when we talk about data sets and we talk about the recommendations that we're giving, we can base it on fact when we have fact, or we can base it on experience when we don't have the facts. Dr. Anthony Fauci is a world-renowned epidemiologist, virologist, infectious disease guru. And we don't know the data because we have never been at this point, because this is a novel virus. But what we do know is the behavior of coronaviruses throughout time. And what we know is that because you have no immunity at all to this virus, no one does, no human, when it started. Now some people do, obviously, but when it started, no one did. So as you get it, you have to make so much antibody to kill it in your body so that you can coexist and you can live, that the probability of you having so much antibody and not being protected, that's going to be very, very low. So what we think in our estimation, what we think in our experience, from our experience, is that this will go away. You will be protected for this season. But for next season, meaning next spring, we're not sure. Just like with influenza, we have to get a shot every year, vaccine every year, because it switches a little bit. But with this particular virus, we think that through this season, you will be protected up until next season, and then there's more work to be done. Any other questions?
Thank you very much, Doctor.
Thank you very much, Governor.
Okay, Greg?
Governor, as you talked about the money from the federal legislation arriving to supplement the state's unemployment, is that your understanding that's retroactive? And also, What is your understanding from your secretary about how long it's taking for people to apply, even if they went to the non-peak hours?
Well, I can't tell you. I know that there are some people who have called in multiple times during the peak hours, and they've not been able to get through. We're encouraging them to call later in the day. I believe they can call up until 7 p.m. The online application is available 24 hours a day, and that's why we're encouraging people to do that after 10 o'clock at night, because the volume really does go way down at 10 o'clock. Now, the funding just came in. It is going to be in place through July 31st, the enhanced unemployment benefits through the CARES Act. It's pandemic unemployment assistance, and it's not just available for those people who would traditionally qualify for unemployment benefits, because typically 1099 contract workers, self-employed workers, gig workers, they wouldn't qualify. They are going to qualify for that $600 a week through July 31st. And so we are going to start getting those checks out on Monday, and they will go through that time period. It is really important for everyone to do their initial claim file, but also to weekly recertify, because the law requires them to recertify. You may remember that I waived the requirement that people have to wait a week after they become eligible to get their first benefits, and I also waived the job search requirements right now, so that's not going to be an issue. But you do have to go in and recertify. That's critically important. The law just simply doesn't allow us to continue to pay benefits week after week for people who are not recertifying that they remain eligible.
And is it retro? I'm sorry, but does it catch up for those that were unemployed right immediately when the crisis hit?
Well, you know, I don't know the answer to that question, and I will get you that answer. I know it goes through July 31st, and we do have some people who've applied for benefits over the last 3 or 4 weeks related to COVID-19. And do they go back and pick up that $600 a week? I don't know. Quite frankly, I should know the answer to that, and I apologize. I'll get that to you. Yes, sir.
Governor, you talked about the trajectories of different areas of the state being different, because obviously New Orleans was hit first. We know for Baton Rouge, for instance, you know, we're seeing good trends in New Orleans. Are we still seeing the trend line going in the wrong direction in Baton Rouge, for instance?
Well, we see that the case numbers are increasing in Baton Rouge, and they are at least a little bit behind New Orleans in that regard, but they're not more alarming than the numbers that we saw in New Orleans. And if anything, they're slightly less alarming, and that's because before there was a significant outbreak and seeding of the virus in Baton Rouge, we actually put into place some mitigation measures. And so you didn't have that really steep rise in cases like you've had elsewhere. But that can always happen. If at any time the people of Louisiana decide that they're just not going to follow the mitigation measures, they're not going to obey the stay-at-home order, do proper hygiene and so forth, these cases will spike, whether that's in Baton Rouge or in New Orleans or wherever. That's going to be the result.
Do we know if you anticipate we're going to hit a point where within the 2-week modeling that you guys have, the Baton Rouge region will show it's going to exceed its capacity for hospitals or events, or do you think we've avoided that?
No, I can't say that we've avoided it, but I don't want to say that it's going to happen either. Right now, what I can tell you is the modeling does not show that we will exceed bed capacity or ventilator capacity anywhere in the state of Louisiana in the next 10 days. When you start trying to get beyond the 10-day period, you're really guessing more than anything else, and I don't want to engage in that. And look, I recognize that what I just said is very different than what we said last week. That's because we have different facts this week. And it's not just modeling in Louisiana that has changed dramatically over the last several days. Look at the modeling for the country as a whole. This is what we're seeing. And the improved forecast, if I can call it forecast, the improved modeling, those numbers of total cases and deaths that we think we will see, they are all premised upon us continuing to do the mitigation that is currently in place. And so if we want to get back to where we exceed our capacity to deliver health care, if we want to get back to where we're going to have patients who need a ventilator and can't get one, all we have to do is resume our normal daily activity, stop following all of the mitigation measures, and that's what's going to happen. So that is my number one message for the people of Louisiana is thank you for what you've done thus far. For those of you who haven't, I'm asking you to get in line. and start staying home. Only go out when it's essential, and don't do that more frequently than is necessary. And when you go out, wear that face covering. If you're going to be in close proximity to others, social distance to the maximum extent possible, and use hygiene. The practices we've talked about, washing your hands frequently and for 20 seconds with soap and water, hand sanitizer when you can't get to soap and water. Make sure you cover your cough. Stay home when you are sick. No matter whether you think you have it or not, stay home if you are sick. Yes, sir, Leo.
To follow up on this question, East Baton Rouge Parish is still only 25% of the test rate of Orleans, and yet East Baton Rouge is the most populous parish in the whole state, more than 40,000, or 40,000 more than Orleans. I realize that the hot spot was in Orleans Parish, but why is it taking so long to ramp up and get test results back for East Baton Rouge when you have more people living here than in any other part of the state? We're half the rate of testing in Shreveport.
Yeah, first of all, we're hopefully testing people who are symptomatic. So if we're testing symptomatic people, we're testing symptomatic people, and it doesn't have so much to do with how many people live in any one particular area. And that's been my charge to the Department of Health, working with all of the hospitals and clinics, is that we're going to do as much testing as possible, but within the proper protocols. As we mentioned before, if we administer these tests to people who are asymptomatic, the result is not going to be reliable, and therefore someone could actually have the virus, have the disease. They'll be told that they don't, and they will potentially not engage in the mitigation measures and social distancing, the quarantining and isolation that they should. But you know, nobody is happy with the amount of testing that we've done, because we want to have more visibility, not less. But I will tell you, Leo, we've done more testing per capita than any state in the United States of America. And we're trying as hard as we can to test those individuals who need to be tested, and we're going to continue to increase that capacity. And as new and better tests come online, we hope to get results in much, much quicker. 95% or so of the testing that we've been reporting over the last 10 days or so is coming from commercial labs. And as you know, they've been reporting that their volume has just caused backlogs, and so we're not getting those results as fast as we would like. And by the way, they're doing better, and we're talking to them about doing better, and we're trying to get different clinics and hospitals to move away from those testing companies that are slow with their results and move towards those that are faster. So I'm not saying that we're satisfied with what we've been doing. We're trying to do better, but we're trying to make these tests available all across Louisiana to the people who are symptomatic and in those categories that we talked about. Yes, sir.
Going back to those $600 federal unemployment checks, for gig workers who we've talked to in the past few weeks who obviously haven't been eligible, and they've been denied, obviously, is all they need to do is apply now, it will go through, and then as far as the workers who have already gotten unemployment, they don't need to do anything else.
They do not have to do anything else other than recertify every week. And so if you had an initial application from someone who's a gig worker and it was more than a week ago, I would tell them that they need to recertify. But the process will look very similar with respect to those people who qualified for traditional benefits and those who didn't from this point forward through July 31st, because the benefit runs out at that point. Yes, Jeff. I'm coming back to you, Melinda.
Obviously, this weekend is a big family weekend. What would your advice be to families? I mean, could you do a crawfish boil and still social distance? And then another question for you. Another question, I've heard government leaders answer this question, and kids are asking this. Is the Easter Bunny an essential worker?
Well, you know, I hope the Easter Bunny pays me a visit. He normally does, or she normally does. I'm not sure what gender the Easter Bunny is. Look, I'm asking people to be patient, and the fact of the matter is, you can boil crawfish for your immediate family, those people who typically eat together and reside together. You should not be doing a block party. You shouldn't be inviting all your siblings and children and grandparents and in-laws over to a house. And remember, we've asked that when you have to gather in a group, that group be no more than 10 people. But we're asking you not to get in a group of 10 people if you can avoid it. And so Yeah, it's Easter, and that's a very special day, and it's the biggest day for Christians in the year, and all that sort of thing. And I get it. I mean, that's true for me too. But we need to be very patient. And this Easter is not going to look like previous Easters, but it doesn't mean that you can't find some significant way to meaningfully worship and to celebrate. But we shouldn't do it. We shouldn't do it in groups of people that violate what we've been talking about. There was no Easter exemption from the stay-at-home order. There was no Easter exemption from the 10-person limit because that virus isn't going to honor that. This is about the virus. The virus is very much in control, and that's why we're trying to do things that will actually limit the impact of the virus. Melinda, you had a question?
I do, about the testing sites at the Walmarts in Shreveport and LaPlace. How are those going to work? Are they going to be like the other drive-through testing sites we've seen where you need some sort of form from your doctor that is sent over? Explain the logistics of it for me, please.
Yeah, sure. So in some ways they're going to be very similar, in some ways a little bit different. So they will be just drive-up testing sites for, like the ones in New Orleans, where we're asking for specific populations that the governor just shared, first responders, healthcare workers, and individuals over 65. At least initially, we want to get a sense of what these sites can handle. Unlike Baton Rouge, and symptomatic, 100%. And the governor's better on message than I am on this. We only want to be testing people who are symptomatic. So individuals in those groups who are symptomatic. Initially, they won't need a prescription or something like that to use those sites. Here, individuals are going to be instructed on how to actually use a nose swab themselves. So I believe they'll be watching a short video. And these sites have been operated by Walmart in Chicago previously, so they're bringing some of their learning to the state. And so they'll put their own swab in after seeing how to do it. That swab will then be handed over to the staff that are working those drive-through sites, and then they'll go on. There will be an app, I believe, by which they will have access to the results. So one of the concerns that we had heard early on from some of our sites was waiting on these phone calls. And so we've got a couple of different ways that we're trying to get the results back to people in a timely fashion.
So is there, based on the experience in Chicago, do you know what the turnaround time was for results, and were there any problems with the use of the app?
So I don't know. I will say that I believe it's Quest that's providing the testing for these. And Quest has been doing a lot of work, I think, because of national attention, to increase their turnaround time. So I'd imagine it would be similar to the Quest turnaround time, and hopefully continuing to improve in the coming days.
And the Shreveport one opens today, and the LaPlace one
That's
Saturday?
Right. There's a soft opening in Shreveport today, and then I think we're hoping to see more numbers over the weekend. And in LaPlace, similarly on Saturday, they're hoping to start accepting a small number through, as the governor noted, taking Sunday, Easter Sunday off, and then Monday starting in large numbers. And it's worth noting in LaPlace we also have Ochsner Health System operating a mobile testing, or rather a drive-through testing as well.
I have a question for you,
Yeah.
Alex. We saw a pretty huge jump in the number of nursing home cases and deaths today at nursing homes across the state. Can you explain why that might be? And also, what is the state doing to help these nursing homes? There's 436 of them across the state.
Yeah, I mean, so sadly, as we've shared from the beginning, this is one of the populations we have the greatest concerns about, because we know that they have almost all of the risk factors, most likely to have most of the risk factors that we worry about for doing poorly with COVID-19. That's being over the age of 65, that's having not only one underlying condition, but sometimes multiple underlying conditions, common ones like hypertension, like diabetes, obesity, and kidney damage. That hypertension and diabetes bring with them. So I think when we see the case numbers increase, sadly it's part of the reason that we are trying so hard to get people to stay at home. We know that those numbers can continue to increase if we continue to have spread in our communities, and the best thing we can do to keep those populations safe is really to not interact with them more than we have to. But people in a nursing home need help by definition. They need that assistance. And so there are workers that are going back to their home communities and coming back to work each day, and we're grateful that they are. But we still are not able to keep the virus out of every facility because of that reason. So what we're doing is we're working with the nursing homes, we're working with the Nursing Home Association, we're working with the CDC. We're taking the best guidance that we have, the best information that we have, learning from places like Seattle and other nursing homes around the country and now state, and trying to put in process the kinds of measures that are going to keep these individuals safe, including restricting visitation that we did early on in this outbreak, including even before then, giving recommendations on how to isolate people who are known to have the virus but able to stay at the nursing home, people who we suspect may have the virus and are undergoing testing, and the people that are so far not showing signs and that we want to keep free from the virus. And each one of those populations are existing in the same facility, in these facilities, and we have to figure out how do we manage those three populations in these tight spaces. One of the things that we're doing as a state is giving them personal protective equipment. We know that protective equipment has been very thin on the ground. Luckily, we're getting more of it in the state. We're encouraging those nursing homes to reach out through the local coordinators, response coordinators, to get those requests to us so that we can get those supplies out to them, because that's a critical part of keeping the residents safe, keeping the staff safe, and trying to reduce the growth in new communities. But what I'll say is this virus continues to spread. Sadly, we anticipate that we're going to continue to see this spread in those centers.
How much PPE have you distributed to nursing homes in Louisiana?
Unfortunately, off the top of my head, I don't know that answer, but we can get that to you.
Okay, any other questions? Governor,
the doctor, I was wondering. Yes.
come on back up.
Basically, to piggyback off of what she was saying about with what we can do now for minorities and things like that. What's the coping solution for parents of kids that have problems or and people with anxiety, or actually people with parents that have dementia or anything like that? Okay. What can they do now to help them deal with those situations?
Well, that's a very important question, and what I will say to you is that we need to start controlling what we can control. We need to let things go that we can't control, and that will decrease the anxiety. Now, what I will say is that the next 120 days are so important. And the reason why we talked about, the governor talked about how the curve is probably starting to flatten a little bit, okay? That's awesome for us. But the reality is that if we don't continue with the stay-at-home order and do the things that we need to do for this Easter, then we might not have a great Easter next Easter. That's the reality. So what we must do is that as we start to get our own control over the next 120 days, you have to make sure that you do the things that you need to do in your household to protect your pod. Keep your hands washed. That's something you can control. That decreases anxiety. Making sure that you are physical distancing, and I think that's very important. We always say social distancing, and that's important, but I want you to think in your mind physical distancing, because the social support of that network that you have is very important for you to be able to have to decrease that anxiety-ridden response that you're having, okay? Parents and children are at home now, and a lot of people are saying, I cannot believe what the teachers actually go through every year with my child. And that is causing so much anxiety for so many people, and people are living in very close quarters. Even animals are saying, what are you doing here, sir? You don't live here 8 hours of every day. So everyone is dealing with a lot of extra stress. Mindfulness, I want everybody to go to their phone and download a mindfulness app. Stay in this moment. What's past is past. What you can control in the future, control it. If you can't control it, you have to put it in the hands of how this virus is going to go. But when you stay to that course and double down right now, that will get you through.
Yes, sir.
What realistically, I mean, you have 277,000 people who are not just simply reemployed as soon as the stay-at-home order is lifted. What realistically does personal economic recovery look like, given that things just don't go back to normal once this virus and the curve flattens?
Well, we've never been through that before, and so I can't tell you with any precision. All I can tell you is we are committed to working as hard as we can and making available every form of assistance, every benefit that we can bring, every bit of flexibility we get from the federal government and funding and so forth. We know what the CARES Act has done, and that's the third installment from Congress. They're already talking about a fourth installment, and they're talking about doing some things in the next several days to help small businesses. So one of the things we can do to get people back to work is make sure that as many businesses as possible resume operation just as soon as it is feasible for them to do so. So the Small Business Administration loans that are forgivable under certain circumstances. And by the way, I think yesterday, the last figure that I got, that of the original $350 billion available for the Paycheck Protection Program through the SBA, this was sometime mid-afternoon yesterday, about $70 billion had already been accounted for. So that's why they're already talking about doing another installment of funding for that program. But I encourage Louisiana businesses, do not delay. Go to your bank, apply for this assistance if it's going to be helpful to you. Do what you can to qualify for a forgivable loan. And that means you have to keep people on your payroll. And so that's better for the individuals that you were just talking about. And then there are going to be other things that we're doing, like the loan portfolio guarantee program that the state is doing in concert with local banks here in Louisiana, that is on top of what the SBA is doing. And then we're going to continue to work to make sure we stand our economy back up just as soon as we possibly can, because we know how much how much hardship that this is bringing on now, and that's likely to continue for some time going forward. And we want to get through this just as quickly as we possibly can. A couple more questions. Yes, sir.
The state has spent more than $500 million responding to the coronavirus. Most of that is through GOSEP. As we see like the curve flatten and we no longer expect that we're going to exceed our hospital bed capacity, and we have leases for like hotels and that sort of thing, do you expect that number to continue to rise like we've seen? Are we going to be spending it on other facilities or other areas?
You know, the answer to that question sort of depends on the cooperation we get from the people and whether the trends that we're starting to see hold true over time, and that we don't just flatten the curve, but then we start to go down. If that happens, then those expenditures will obviously be lower than they otherwise would be. And we have to make sure that we know where we're headed, and you do that based on modeling. And if there's any chance, if there's any realistic chance that you exceed your capacity to deliver health care, then you have to hedge against that by making the investments, the expenditures necessary to have additional capacity at the Ernest Morial Convention Center, for example, at the Personnel Holding Unit there across the street from the Convention Center. Obviously, if we're not trending in that direction, then we won't continue to make those expenditures. But this, you know, we have to do what I think prudence demands of us, and we have to be prepared for what is the worst case feasible scenario, because we don't want to lose life unnecessarily. We don't want someone to die simply because they didn't have a ventilator available to them, and that's what they needed, and with that ventilator they would have lived. And so we pray that we don't get there. And if we don't get there, it will be because the people of Louisiana took seriously the mitigation measures, the stay at home, the social distancing. And that's been my message throughout, is that we could control how bad this gets. And it's looking now like the people of Louisiana are understanding that and acting accordingly. And I do hope that these reports that I've gotten today, and they are rather anecdotal, y'all are out and about more than I am, but I'm told that the traffic is a little bit heavier today than it has been previously, and that's not a good indicator. So hopefully we will double down on these strategies, which we know work. We know they work. One more question if you got them. And I guess you don't. Thank you. Same time tomorrow, Sean. So we'll see y'all at 2:30 tomorrow. And I want to thank Dr. Hebert again for being here with us today. And thank you all too.
Governor John Bel Edwards saying same time tomorrow, which means we will cover that as well, 2:30 here on NBC Local 33 and Fox 44, and as always live streamed on the brproud.com website. But again, just to reiterate the biggest headline for today, Governor Edwards announcing that $600 federal aid each week for those who are collecting unemployment, be it self-employed or under the traditional unemployment bed roster here. Those $600 in federal aid will be coming starting next week, and that's set to be running straight through July the 31st. So that being the biggest development, especially when it comes to those independent contractors we've been covering for the better part of the past few weeks. But again, just to recap, the governor will be speaking tomorrow at around 2:30, and we'll have the very latest there. In the meantime, we will cover the very latest on the governor's remarks and on the state's response to the coronavirus on NBC Local 33 News at 5 o'clock and Fox 44 News at 5:30. But for now, we're going to take you right back to regular programming. I'm Harrison Golden. Good day.